Have you ever wondered what happens after a surgery? Well, the journey doesn't end as the surgeon puts down their scalpel. That's merely the beginning of a crucial phase known as post-surgery care. This phase plays a pivotal role in a patient's recovery process. And the spotlight here is on a dedicated department known as the Post Anesthesia Care Unit, or PACU. Post-surgery care is a delicate dance of monitoring and managing the patient's transition from an unconscious state to full alertness, while also managing pain and watching for any potential complications. It is in the PACU where this dance is choreographed and executed with precision and care. In essence, it is the PACU that stands as the patient's first line of defense in the post-operative phase, ensuring a smooth and safe transition back to normalcy. So stick around, because in the next few minutes, we will delve deeper into the world of PACU. So what exactly is the Post Anesthesia Care Unit? Well, let's dive right in. The Post Anesthesia Care Unit, also known as PACU, is a critical area within a hospital setting. This is where patients are taken immediately after surgery or procedures that require anesthesia. Essentially, PACU serves as a bridge between the operating room and the patient's next step in recovery, whether that's going back to their hospital room or being discharged home. Now let's talk about the primary function of PACU. The core purpose of this unit is to provide care for patients as they recover from the effects of anesthesia. This involves close monitoring of vital signs, managing pain, and assessing for any potential complications. It's all about ensuring that the patient is safe and comfortable during this critical post-operative period. Anesthesia, while incredibly useful for procedures, can have various effects on the body. It can impact breathing, blood pressure, and even consciousness levels. Hence, the period immediately after anesthesia is a sensitive time, requiring specialized care. And that's exactly what PACU provides. One interesting thing to note about PACU is its location. It's often situated in close proximity to the operating rooms. Now, this isn't by chance. It's a strategic move to ensure the smooth and swift transfer of patients post-surgery. This close proximity also allows for immediate access to surgical or anesthetic personnel if a patient requires urgent attention. To sum things up, PACU is an essential part of a patient's surgical journey. It's a specialized unit dedicated to the care of patients recovering from anesthesia, focusing on monitoring, managing pain, and identifying any potential complications. Its strategic location near the operating rooms facilitates quick patient transfers and immediate access to surgical or anesthetic help if needed. Now that we know what PACU is, let's move on to understand what exactly happens in this unit. You might be wondering, what is the role of PACU in patient recovery? Well, the Post Anesthesia Care Unit, or PACU, is akin to a lighthouse guiding the ship, where the ship here is our patient, and the tumultuous sea is the immediate post-surgery period. The PACU is where the patient is closely monitored as they recover from the effects of anesthesia. Right after surgery, patients are often groggy, disoriented, and might even experience pain. It's the PACU's job to ensure that these transitions are as smooth as possible. The highly trained staff of this unit are like vigilant sentinels, monitoring the patient's vital signs like heart rate, blood pressure, and oxygen levels. These indicators give us a real-time snapshot of how the patient's body is coping after the surgery. But the role of PACU doesn't just stop at monitoring. It also involves managing pain, nausea, and other side effects that might arise due to anesthesia. Imagine waking up from surgery, feeling nauseous or in pain. It's not a pleasant feeling, right? That's where PACU steps in. With their specialized knowledge and skills, the staff can administer appropriate medications to alleviate these discomforts, ensuring that the patient's recovery process is as comfortable as possible. Another crucial role of the PACU is preparing patients for discharge or transfer to another department. Be it the hospital room or their own homes, transitioning from the PACU needs to be handled with care. The PACU staff ensure that the patient is stable enough for the transfer. They provide detailed instructions about post-surgery care, medications, potential complications, and when to seek medical help. This comprehensive handover is essential to prevent any post-surgery complications and to ensure a smooth recovery. So, you see, the PACU is more than just a recovery room. It's a place where the journey from grogginess to alertness, from discomfort to comfort, and from vulnerability to stability happens under the watchful eyes of dedicated healthcare professionals. Clearly, the PACU plays a critical role in ensuring a safe and smooth recovery for patients post-surgery. A successful PACU operation relies heavily on its team. So who are these people? Dive into any PACU, and you'll find a highly skilled team of healthcare professionals working together like a well-oiled machine. This team's primary goal? To ensure that patients wake up safely from anesthesia and manage any pain or side effects they might be experiencing post-surgery. At the helm of this team, we have the anesthesiologists. These are the individuals who have been with the patient from the start, administering anesthesia during surgery. They continue their vigilance into the PACU, monitoring vital signs, adjusting pain medications, and ensuring that the patient is stable. But, of course, anesthesiologists don't work alone. They're supported by a team of dedicated PACU nurses. These nurses are the patient's primary caregivers in the PACU. They keep a close watch on the patient's condition, monitor their recovery from anesthesia, manage their pain, and provide comfort during this critical period. Their expert eyes and hands are vital in detecting any complications early and intervening promptly. Then, there are the respiratory therapists. These professionals are essential in managing any breathing-related issues post-surgery. They ensure that the patient's airway is clear and that they are breathing effectively. In addition to these key players, the PACU team may also include other healthcare professionals. These can range from pharmacists, who manage the medication used in the PACU, to physiotherapists, who help patients start moving safely after surgery. And let's not forget the unit clerks and patient care assistants who manage the administrative and support tasks, allowing the medical professionals to focus on patient care. Each team member brings unique skills and expertise to the table. They work in harmony, their roles intertwining seamlessly to create an environment conducive to safe and speedy recovery. Through their collective efforts, they ensure that each patient's post-surgery experience is as comfortable as possible. Whether it's managing pain, monitoring vital signs, or simply providing a comforting presence, the PACU team plays an indispensable role in patient care. The PACU team, through their collective efforts, ensures that each patient's post-surgery experience is as comfortable as possible. Now that we know who makes up the PACU team, what does the typical PACU process look like? Let's walk through it together. Imagine a patient has just completed their surgical procedure. The moment the anesthesia starts to wear off, the patient is transferred from the operating room to the Post Anesthesia Care Unit, or PACU. Here, they are greeted by a team of highly skilled professionals dedicated to their recovery. The PACU nurse takes the lead, ensuring the patient's vital signs are stable. This includes monitoring heart rate, blood pressure, and oxygen levels. The nurse also assesses the patient's level of consciousness and pain. Then comes the management of post-operative symptoms. It's common for patients to experience side effects from anesthesia, such as nausea, vomiting, or chills. The PACU team is prepared for this. They administer the appropriate medications and interventions to alleviate these symptoms and ensure the patient's comfort. But that's not all. The PACU nurse also checks the surgical site for any signs of complications. They look for factors like bleeding or infection and take measures to prevent these from escalating. Communication plays a vital role here. The PACU team keeps the patient informed about their progress and addresses any concerns they might have. For instance, if the patient complains of pain, the PACU nurse promptly administers pain relief and adjusts the treatment as required. The PACU process doesn't just end with symptom management. The team also prepares the patient for the next step of their recovery. This could mean a transfer to a hospital room or even home, depending on the type of surgery and the patient's overall health. For a patient being discharged, the PACU team provides detailed instructions about home care. They may discuss things like wound care, medication schedules, potential side effects to watch out for, and when to seek medical attention. They ensure the patient and their caregivers understand these instructions fully before they leave the PACU. For a patient being transferred to another hospital unit, the PACU team coordinates with the receiving team. They share crucial information about the patient's surgery, recovery progress, and any special care needs. This ensures a seamless transition and continuation of care for the patient. The PACU process is a well-oiled machine, with each team member playing a crucial role. It's a collaborative effort that prioritizes the patient's safety, comfort, and well-being. The PACU is more than just a unit where patients wake up from anesthesia. It's a place where recovery begins, where pain is managed, and where patients are prepared for the next step in their healing journey. As you can see, the PACU process is designed to ensure that patients are stable and comfortable before they leave the unit. We've talked a lot about the PACU, but why is it so important? Let's delve into that. The Post Anesthesia Care Unit, or PACU, holds a critical role in the surgical process. It's not just a waiting room where patients recover from anesthesia's effects. No, it's much more than that. You see, the PACU is the first line of defense against post-operative complications. It's where the vigilant eyes of highly trained nurses and doctors closely monitor patients as they transition from a state of unconsciousness to full alertness. They track vital signs, pain levels, and any signs of distress, ensuring that patients are safe and stable post-surgery. But it's not just about safety. The PACU also plays a crucial role in patient comfort. Imagine waking up from surgery disoriented, in pain, and alone. Not a pleasant thought, right? Well, that's where the PACU comes in. The PACU team is there to provide reassurance, pain management, and emotional support during this vulnerable period. They help to make the transition from surgery to recovery as smooth and comfortable as possible. Let's not forget the PACU's role in reducing the risk of post-operative complications. Complications like pneumonia, blood clots, and surgical site infections can all occur after surgery. But in the PACU, the team is actively working to minimize these risks. They encourage patients to do deep breathing exercises, move their legs, and provide wound care instructions, all of which are crucial for preventing these complications. And lastly, effective PACU care can significantly influence the overall success of the surgical procedure. A smooth recovery can mean shorter hospital stays, reduced healthcare costs, and most importantly, improved patient outcomes. It's the care provided in the PACU that sets the stage for the rest of the recovery journey. So when we talk about the importance of the PACU, we're talking about patient safety, comfort, and the reduction of post-operative complications. We're talking about the difference between a smooth recovery and a complicated one. Indeed, the PACU is a critical component of the surgical process. It's the unsung hero of patient care, working behind the scenes to ensure that patients transition safely and comfortably from surgery to recovery. So, we've learned quite a bit about the PACU today. Our exploration began with the basics, the definition of the Post Anesthesia Care Unit, or PACU. We discovered that it's a critical area in any hospital where patients are closely monitored following surgery. This is the place where you'll find patients regaining consciousness after the anesthesia wears off, under the watchful eyes of a dedicated healthcare team. We then delved into the role of the PACU in patient recovery. It's not just a place for patients to wake up from anesthesia. The PACU serves as a crucial first step in the recovery journey. It's here that the initial post-operative assessment takes place. Pain is managed, complications are identified early, and the process of healing truly begins. Our journey through the PACU wouldn't be complete without acknowledging the incredible team that makes it all happen. This team is made up of highly skilled professionals, including anesthesiologists, nurses, and other medical staff who specialize in post-anesthesia care. They work tirelessly to ensure that every patient receives the best care possible from the moment they arrive in the PACU until they're ready to move on to the next stage of recovery. We also walked through the typical PACU process. Upon arrival, the patient's vital signs are checked and their pain is assessed. Throughout their stay, the team continues to monitor these signs, adjust pain management strategies, and prepare the patient for the transition to the next level of care. It's a carefully orchestrated process, designed to ensure the patient's safety and comfort at every stage. Finally, we highlighted the importance of the PACU. This unit plays a pivotal role in patient outcomes. The immediate post-operative period is a critical time when complications can arise. The PACU provides a controlled environment where these potential issues can be identified and addressed promptly, improving the chances of a successful recovery. In the grand scheme of a patient's surgical journey, the PACU might seem like just one small piece, but as we've learned, it's an essential part of the process. It's the bridge between the operating room and the recovery room, a place where the healing process begins and potential complications can be caught early. The PACU team, with their specialized skills and patient-focused approach, are the unsung heroes of the surgical process. They're there when patients are at their most vulnerable, providing care, comfort, and expertise to guide them through the first stage of recovery. So, as we wrap up our exploration of the PACU, let's not forget the importance of this unit and the team that runs it. It's a testament to the complexities of healthcare and the dedication of those who work within it. Remember, the journey to recovery doesn't end at the operating table. It extends into the care provided in the Post Anesthesia Care Unit.